Working with patients in acute pain can be challenging for manual therapists. In the initial phases, we can use our manual therapy techniques to try to create symptomatic and functional modification on a temporary basis. But ultimately, we know that movement and exercise is going to create long-term lasting changes. Now, in the very acute phase, we may need to avoid the patient moving into positions that they may find uncomfortable. But once things start to reduce, we need to then expose the patient to those uncomfortable positions. We need to start moving the patient, creating some tolerance, creating some confidence, using habituation to try to make those movements less painful and more tolerable. Something as simple as this flexion extension for the spine, the thoracics and the lumbars can be a really easy way that we can start to introduce movement patterns for our patients' rehabilitation. It can be done under low load. It can be done under patient control. They can tolerate how much movement they are doing, and this can be done multiple times a day. They don't need access to a gym. They don't need access to equipment. This is a very fantastic way that we can introduce movement very simply as part of the rehabilitation process. Remember, the most effective techniques tend to be the most mundane, something very simple that the patient can do, they can tolerate, they can gradually dose, they can increase, and then they can build upon. Ultimately, movement, education, and confidence is key.